possibly a second chance for you, even if chemo, radiation, or surgery didn't work or isn't tolerated. Our goals are best results and quality of life. Meet Dr. Lederman to hit the cancer. For a free booklet DVD, call 212-CHOICES, 212-CHOICES for a fresh second opinion. Most insurances, Medicare, Medicaid accepted. Not only super convenient, super Broadway and 38th in Manhattan. To hit your cancer, see Dr. Lederman, 212-CHOICES, 212-CHOICES.
With Dr. Lederman, the best prostate cancer treatment is custom tailored for you. Each man with prostate cancer is unique and seeks the best results based on PSA, Gleason score, and stage. That's why Dr. Lederman's custom-tailored prostate cancer treatment is most logical. Not every man should get the same treatment. Dr. Lederman's custom prostate cancer treatment is all outpatient. Our goals are your best results, avoiding radical surgery, maintaining your sexual and urinary function, and your life. Most insurances, Medicare, Medicaid accepted. Call Dr. Lederman at 212-CHOICES, 212-CHOICES for a fresh second opinion and free booklet DVD. Not only super convenient, super in Manhattan, 38th and Broadway. To hit the cancer, call Dr. Lederman, 212-CHOICES. Cherish your life. Custom prostate cancer treatment with Dr. Lederman, 212-CHOICES.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WOR Studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. You can also call Dr. Lederman at 212-CHOICES for a free informative booklet and DVD. Hey, Dr. Lederman, we're back.
Hey, we're back, and I hope you're all doing well. This is Dr. Lederman talking about things to make your life better. I want to speak about a woman who came from a neighboring state, but a 50-year-old black woman came with her beautiful family, daughters and granddaughter. She had lung cancer diagnosed last year. She was in one hospital, fancy-dancy hospital. She then went to another hospital in this neighboring state, and they were giving her chemo. I guess you get the picture. She had lung cancer. A year ago, she had a mass up against the airway. They're giving her chemo. Well, at that time it was 3.5 centimeters, which would be about 1.5 inches. On chemo, it's growing to 7 centimeters. And guess what they did? Chemo. Doesn't sound right? If the treatment's not working, why would you stick with a treatment that's not working? It doesn't make sense. Finally, she's feeling lousy. She came to a short of breath, headaches, just miserable. And she was at this hospital, next state, and just keeping chemo, and not evaluating, not listening to the patient. Listen to the patient. You'll learn so much. I staged her up. What happened? We staged her up. She came to me maybe like 10 days ago on a Wednesday at 2. By 6 o'clock, she was staged up. The brain. Why the brain? Because she was having a headache. She wasn't fine. And the body, she wasn't fine. And we found in the brain, she had 15 brain metastases. The cancer had traveled to the brain, and no one had looked. Wow. And in the body, the cancer in diameter had doubled. Now, when a cancer increases by doubling in diameter, that means the volume, the amount of cancer cells, increased by huge amounts, more than doubled, tripled, quadrupled. So we started her on treatment for the brain. Within days, she's feeling better. Her family says her headaches are gone. Hopefully the cancer is going away with our treatment. And we're also treating the lung mass, which is causing obstruction of the airway, which had grown so much. So we're taking care of the patient. So when people say you have to have chemo because the cancer's everywhere, well, is the chemo working or not working? Is the patient getting better or worse? Is the patient tolerating the treatment or not? If you're not getting better and you're not tolerating the treatment, it may be time for a second opinion, for someone who will, we believe, listen to the patient. So this patient and her family, as many daughters, they're all happy that she came to Radiosurgery New York. I'm not just tooting my horn. You can speak to her if you wish. Another woman just finished treatment for anal cancer. So again, not a very common cancer. This woman's from Switzerland. She's about 75 years old. Staged her up. She had been diagnosed before, but she never got treatment. She just couldn't decide what to do. We saw her, we staged her, meaning we knew exactly where the cancer was to the best of our ability. It was in the anus where it started, which is different than the rectum. The anal cancer is different from rectal cancer. Totally different, really. And its spread is different, its treatment is different. We treated her with combined modality therapy, including focused radiation. She has done superbly. Her medical oncologist called me this week to say that the cancer's in remission. She's happy, no symptoms, feeling well, maintaining her weight and quality of life. She will come back in a month. She just finished her treatment this week. She'll come back in a month for a checkup. She, like all my patients, have my cell phone number. She can call day or night if she has questions. She'll get staged up too, and we stage up people so the patient knows, and the patient has a copy of the records. The patient knows exactly where the cancer is and hopefully where it isn't. We hope that it's gone from her body. That's what we want, gone from her body. Right now, this woman is doing fantastic, in remission from anal cancer after our treatment. And another woman, boy, this is a day of women for Father's Day. Another woman from South America, she's about 80. I've been treating her for 10 years. She had a head and neck cancer. She had standard treatment elsewhere. Standard treatment didn't work. The cancer came back in her head. We treated that about 10 years ago. She's been in remission from what we treated those years. She comes back maybe twice a year. I would like her to come back a little more, but that's all she wants to do, and she's the president of the United States of her body. And now she came back after missing for a year. The cancer had traveled to the lungs. Stage 4, actually during those 10 years had been in the lungs before elsewhere. We treated it elsewhere, and now there's a new spot. We're treating a new spot. She's avoided chemotherapy for 10 years. Probably if she got hooked up with chemo guys, she would have had chemo for 10 years. No. She gets treatment. We zero in, hit the cancer. She has no side effects. Hit the cancer in her office. It takes about 15 minutes. We're at 38th and Broadway. She comes in, gets her treatment, goes home. She's happy because she's had a good quality of life. She had no chemo, no injections, no lowering of blood counts, no neuropathy, none of those things. Just hit the cancer. If you hit the cancer, there's less side effects than if you have chemo going through your whole body from head to toe. So she had her last treatment just a couple of days ago. Hopefully she'll be back. We usually like to see people back in about 4 or 6 weeks. Check on them. She has my cell phone number. She can call. Her son has my number. He calls. And we keep track of her. Hopefully she'll be in good shape for many years to come. And here's a patient, interesting, a woman from Russia, a day of women. I don't know how it happened, but a day of women. It's a woman who's 60 years old, from Russia, been in the United States for 20 years. Has colon cancer, metastatic to the liver. She had 3 spots in the liver. She'd been getting chemo elsewhere, and she was fed up with chemo. She didn't help her. Cancer was spreading. We treated the 3 spots in the liver. She just finished the treatment and came back for follow-up. Again, our patients get a report with a new scan to know exactly where the cancer is. Did we help or not? And she's got that scan, and the report shows that everywhere we treated, all 3 spots in the liver are smaller, doing well, no side effects, tolerated treatment well. She was treated in the stereotactic frame, which is a non-invasive system that we pioneered we were first in America with body radiosurgery, this kind of technology, because we realized the potential of treating the cancer and leaving the body alone. We're just about at the end of time. We do have another show tonight on WOR at 9 o'clock, a new show. We're taking your medical questions through the day and night, Monday through Friday, Saturday, Sunday, 7 days a week at 212-CHOICES, which is 212-246-4237. So we hope that you have a great day. We hope that you've learned something from these cases. If you have medical questions, call us day or night. If you want the booklet DVD, just give us a call at 212-CHOICES. Thank you for listening. Have a great day. God bless you. And talk tonight at 9 p.m. on WOR. Thank you.
Thanks for tuning in to the Radiosurgery Hour with Dr. Gil Lederman and myself. If you have questions before next week's show or want a free informative booklet and DVD, just contact Dr. Lederman at 212-CHOICES. That's 212-246-4237. That's 212-246-4237. Till next week.
Here's Dr. Gil Lederman, New York's only Harvard-trained, triple-board certified radiation cancer doctor. If chemosurgery or radiation isn't working or isn't tolerated when cancer and its pain and symptoms aren't getting better, seek a fresh second opinion at Radiosurgery New York's Urgent Cancer Consultants for innovative, custom-tailored cancer treatment. See our experts within one business day because we know your time and your life are precious. Our goal is proper diagnosis and effective, non-invasive outpatient treatment. Decades of leadership, first in New York with brain radiosurgery, first in America with body radiosurgery for cancers of the brain, body, and prostate, all custom-tailored for you. Call 212-CHOICES, 212-CHOICES for a prompt appointment and free booklet DVD. Super convenient, 38th and Broadway, with most insurances, Medicare, Medicaid accepted. You're next at Radiosurgery New York. Just call 212-CHOICES, 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 212